Hello, my name is Dr. Neil Baum. I'm a urologist in New Orleans, Louisiana, and I would like to take a few moments to talk with you about the new PSA guidelines for screening and detecting early prostate cancer. Prostate cancer remains one of the most commonly diagnosed non-skin cancers among United States men. There are over 250,000 new cases every year. Prostate cancer remains to be a life-threatening diagnosis with 25,000 deaths annually. Many men will have prostate cancer without knowing it. The only way to screen for prostate cancer is to measure the blood levels of prostate-specific antigen, or PSA, which is a protein secreted by the prostate gland. Prostate cancer grows very slow, and oftentimes men die of other causes. An elevation of the PSA does not mean that you have prostate cancer. It is much more common for a PSA elevation to indicate a benign enlargement of the prostate gland or a prostate gland infection. An increase in the PSA level can lead to a prostate biopsy. Prostate biopsy then can lead to the diagnosis of prostate cancer. Neither PSA testing nor prostate biopsy tells doctors with any degree of certainty which cases of prostate cancer are threatening and which cases require further treatment. The PSA recently has come into question. In 2012, the United States Preventive Services Task Force advised against any routine use of the PSA test for prostate cancer detection in all men. I believe that global ban on PSA testing was far too stringent. At a recent meeting of the American Urologic Association in San Diego in May 2013, they offered new guidelines that I think are more realistic than the ones offered by the United States Preventive Services Task Force in 2012. So what are those new guidelines? First of all, stop screening men after the age of 70 because men over the age of 70 tend to have higher PSA levels without having prostate cancer. The new guidelines also suggest measuring the PSA levels less frequently than once a year, such as perhaps every 2 years in those men whose levels are normal, and especially in those men who have an initial PSA less than 1.0. Also, the new guidelines recommend no testing in men under the age of 40 years old. The new guidelines do not recommend testing with PSA or screening in men with a life expectancy of less than 10 to 15 years. PSA screening is still recommended on an annual basis for men who have a family history, that is, father, brother, uncle, or cousin with prostate cancer, and for African American men. Both of these groups are at risk for prostate cancer and should be tested on an annual basis. So what's my advice? My advice is that a discussion should take place between the patient and his doctor on PSA testing. You need to answer the question, if you get a PSA test and it is elevated, would you submit to a prostate biopsy? And the second question you need to ask yourself is, if the biopsy demonstrated prostate cancer, would you accept treatment for this condition? If the answer to either of those questions is no, then I would recommend against doing a screening with a PSA blood test. My best advice is that you should have a good discussion with you and your physician about PSA screening in your situation. I hope you have found this video helpful and useful. If you have any additional questions, I would like to refer you to my website at www.neilbaum.com. Thank you.